Hello and welcome to the WellCare Podcast by Citius Retreats. My name's George Bownes and I'm a sports and exercise medicine consultant and founder of Citius Retreats.
And I'm Nicola Graham, a strategy advisor in human performance.
So before we get into today's show, here's a few words from our kind sponsor, IBSA. Osteoarthritis is the leading cause of pain and disability in the UK. As our bodies age, there is a loss of naturally occurring hyaluronic acid within our joints, which can lead to reduced shock absorption and lubrication. This can contribute to the development of osteoarthritis, resulting in joint pain, stiffness, and difficulty carrying out daily activities, such as going to work and exercising. Synovial HL is a joint injection with the highest concentration of hyaluronic acid available in the UK, effectively restoring hyaluronic acid in the joint. It is scientifically proven to reduce pain and increase joint function, preserving your joint into the future. Synovial HL is injected in a simple procedure which offers an alternative to medication and surgery. If you'd like to find out more, please visit synovial.co.uk for full product information and a list of clinics offering Synovial HL injections. Synovial. Move freely, live fully. Disclaimer. The procedure must be carried out by an appropriately trained healthcare professional.
Welcome to the WellCare Podcast. In this episode, we are joined by Clare Nieland, who has over 20 years of experience working in the NHS and private sector. Dr. Nieland is a general practitioner and she works with the HOOKE team to deliver the highest standards of individualised specialist care. Passionate about lifestyle medicine, Dr. Nieland employs a lifestyle-first approach, enabling clients to make positive, proactive lifestyle changes towards optimum health. She firmly believes that we underestimate the power of food and nutrition in our health and well-being, and she also specialises in women's health with postgraduate qualifications in contraception and menopause management. So Claire, thank you for being on the podcast today. And what does wellness mean to you?
Yeah, hi guys, and thank you so much for having me. It's really nice to be here. I think for me, wellness is about being the best version of myself that I can be. I have a really busy professional life, a very busy family life. And if I'm not looking after myself, I can't look after everyone else. So it's really important to me that I show up in good physical and mental states. I want to be able to perform at my best, be that work or, if I'm out for a run with the dog or wild swimming or out with friends. So wellness for me is about putting everything in place that means I can achieve that. I mean, I've put in place, practices and behaviors that mean wellness is not especially effortful for me now. I feel like I've spent years kind of stripping back barriers and removing obstacles so that my practices and daily habits are just that, they are habits. And I think that's really important when we're thinking about wellness, because I think being well and having a sense of wellness, well-being can sometimes feel really hard. And I really don't think it should be. I think, the wellness industry sometimes makes it seem quite difficult to achieve. There's so much information out there and sometimes it's really conflicting. And I think particularly when it comes to, as an example, nutritional science, it's really difficult for me as a healthcare professional, as a qualified doctor, to navigate the world of nutritional science. So for my patients, my clients, it's definitely hard. So I think, wellness doesn't need to be difficult. There are plenty of things that we can do for ourselves, and I'm sure we'll talk a little bit about those further down the line. But once we make those healthy habits a regular activity, they do become just that. They become healthy habits, and they are the foundation of good health.
Where you've described that into kind of habits and it becoming lifestyle, that's obviously the ultimate, and where then you do thrive in life. But depending on where, like backgrounds, how you grow up, kind of your environment that you're exposed to, that's not always the norm from our childhood, really. So when in your career or when in your life did you become kind of passionate about this aspect around lifestyle, or change that concept of I'm not just living, I really want to thrive, and therefore I do need to adopt this wellness practice into my life?
So there's a couple of threads to pick up on there, Nicola. I think I I think you're absolutely right. So those wider determinants of health that we talk about, particularly in lifestyle medicine and public health, have such an impact on our health and well-being. And those wider determinants of health need to be recognised because they do have a significant impact on our well-being. And some of them are thought to be out of our control, but there are factors within our control that we can start to take ownership of, and we can start to implement change. I think from a personal point of view, you know, I've always enjoyed exercise, and I've always found that if I prioritize my sleep, I function better the next day, I make healthier food choices, I'm a nicer person to be around. So, you know, for me, I think it's having a realization and an understanding that actually getting those fundamental pillars right means that I can function better. So I've learned that over the years. But I think that I think if we're thinking about how I came into lifestyle medicine, I think it was more a slow realization that actually, you know, tablets, pills aren't the cure. I've seen many, many times that, you know, a pill isn't the answer. So medication doesn't necessarily fix everything, and it certainly doesn't treat the root cause. So I've been using a lifestyle first approach with my patients for many, many years. And I think initially I thought I was working alone. I thought I was doing this, and perhaps I was practicing, you know, on the edge of my scope of practice, because it's not something you're trained in at medical school. You know, you don't learn about the importance of lifestyle medicine throughout our very conventional medical training, although that is starting to change. Some very proactive medical schools are introducing you know, lifestyle medicine to their curriculum, but that's taking a lot of time to change. So I remember I was practicing this lifestyle first approach with my patients with really good results, but felt like I was practicing alone. And I was at a conference, and I remember I approached a table at the conference, and it had a sign that said the British Society of Lifestyle Medicine. And we got talking, and I suddenly discovered that this was a thing. You know, practicing a lifestyle first approach had a name, and there was a charity organization that people belonged to, and that actually I wasn't alone. And I think finding my tribe, finding colleagues and peers who were all doing the same as me, just gave me a bit more confidence to go on and continue doing what I was doing. And it gave me that all-important social connection. It gave me, you know, a platform to share ideas and thoughts and practices. And the British Society of Lifestyle Medicine, of which I'm a member and a regional director, has gone on to grow and thrive and develop. You know, it's now one of the most rapidly growing professional organisations in the country. And I think the other thing for me was the discovery of another charity organisation called the Public Health Collaboration, which does a lot of work with individuals, with schools, with organisations to try and promote a real food approach to better health. And I think, you know, they were doing a lot of work around type 2 diabetes and how lifestyle and nutritional approach can prevent, treat, and even reverse type 2 diabetes in some cases. And I think, you know, it was kind of coming across these organizations that already existed that gave me the confidence to grow and develop my own interest in lifestyle medicine.
That's brilliant. And I think it's a theme that comes out in quite a lot of the conversations, really, about slowing down to notice things as well. Like, so by you slowing down and getting self-awareness of what works for you personally, that allows you to kind of thrive and perform. But to slow it down and notice what's happening in a wider ecosystem of health and medicine allowed you to also find your tribe and then kind of thrive from there professionally as well. So it is a theme that kind of comes through quite a lot of the conversations around self-awareness and that piece of reflection. George, I'll let you jump in.
Yeah, because thank you. Yeah, we were chatting beforehand, and obviously listening that Claire had an unfortunate start to her medical career, that she went to university in London where You don't get a lot
Careful.
of the
Careful,
forward
George.
thinking. I know. Don't worry, we're on safe ground. Whereas Sophie Bostock and I, who's one of the other speakers that we've had on, went to Nottingham, which was very good at embracing wider health issues. So actually, some medical schools were very good at that promotion. But equally, I know exactly what you mean in that it's like physiotherapy. So people do their 3 years of physiotherapy training and they come out at the end of it. Now, they haven't done very much musculoskeletal training. But if you go anywhere and you want, you've hurt your shoulder and you want to go and get some physiotherapy, you go and see a physiotherapist who's either in the NHS or outside the NHS. But that musculoskeletal training that they've done is all very much postgraduate, and therefore they've gone down their line of interest. And it's exactly the same as what you're saying there around, lifestyle medicine is very much it's about me optimizing my health so I can perform better for the people, for myself. I can show up for myself and for the people around me. And you go down, you find your tribe and you go from that. So it's very much a sort of postgraduate training piece more than anything else, because, in the same way that physiotherapy, you've got to go around all the different areas like neuro rehab, respiratory medicine, and musculoskeletal medicine becomes that back end piece. Longevity medicine, wellness, health, whichever label you want to use. And I think it's been really interesting listening to many other guests that we've had on, where when you ask them that starter question of what does wellness mean to you, a lot of people coming back and saying, look, it's just in some ways a different word for health. And it's how you make yourself healthy and what's involved with that. It's not just physically, what do you how many press ups you can do, or just nutritionally, how balanced a diet you can have. But you've got the sleep, you've got psychology, you've got elements in and around that piece. So I think that's really interesting. And going back to the points you're making there about type 2 diabetes, there's good studies that show you can just take metformin in that pre-diabetic state as a way of trying to delay or stop the progression of type 2 diabetes. But physical activity is a huge part in actually reversing it. And if you actually were able to champion physical activity against taking tablet medication, physical activity would outperform it. And then you add in those other elements that you're talking there around nutrition. And we've spoken to nutritionists on this pod previously, and it's about how all that brings together. And I think you go back to what Richie Norton said in the first episode, where he's talking about wellness being a journey, and for all the practitioners and speakers, guests that we've had on this pod during the series, everyone's had their own journey, and everyone sees how it's not just about their bit, it's about how their area of expertise interplays with everybody else. And I think that's what's great about what you're doing, because you've got this NHS role, but you've also got this role within HOOKE as a private provider, and really kind of bringing it together, which is why it's great to have you as the last guest on the series, really to kind of bring everything together.
Yeah, absolutely. And I think that you've had some brilliant guests on your podcast, and I'm really excited to hear the rest of them when they're released. I think lifestyle medicine brings together those, we call them 6 pillars, but it actually brings them all together. And whilst absolutely you can have areas of expertise, actually sometimes you need somebody who can bring those together for a very holistic approach and help make those changes, in different areas, perhaps not focusing just on one particular area. And I think that's what lifestyle medicine does really well. It understands, I have a deep understanding of the importance of those 6 pillars, but also, as Nicola said, those wider determinants of health, and then also behavior change, because it's okay telling someone to do something and make a change, but that's not likely to happen unless there are tools in place to help them make those changes. So an understanding of behavior change is also really important. So as an example, in the NHS, we have something called health coaches, which you might have heard of. And I know a lot of private providers are starting to use health coaches as well, who will work usually on an individual level, but sometimes in a group setting, which I'd love to talk about in a minute. To actually help our clients, our patients, make those behavior changes and make them sustainable. And then you can let go of their hand, you can empower your patient, and they can move on with their life because they've made those sustainable changes. So I think lifestyle medicine brings all of that together really nicely.
Claire, let's pull back. Let's be really clear about what you believe the 6 pillars of health are, so that listeners can understand your approach and your philosophy.
Yeah, fine. So for me, there are the 6 pillars of lifestyle medicine which we use, which are nutrition, physical activity, sleep, social connection, avoidance of unhealthy substances, and then mental health. And although they're very distinct pillars, they're also interconnected. So, for example, having good nutrition, cooking from scratch, avoiding ultra-processed food will have a knock-on effect on all the other pillars, and in particular our mental health. There's some really great work being done by Georgia Eady and her team looking at the benefits of good nutrition for better mental health, and actually using it as a treatment modality for certain psychiatric disorders, which is another specialist area in itself. But we see how good nutrition can then have an impact on your sleep. It means that your ability to perform physical activity improves. And so they are very distinct pillars, those 6 pillars, but they are very much interconnected. And I think for me, it's about looking at that bigger picture, taking a very holistic approach. Small changes in one area can have knock-on positive impacts in another.
And from then a practical point of view, where do you start with patients? What becomes the kind of, I'll use the pun, hook into lifestyle medicine?
So it's about understanding your patient or client, and it's understanding where they're at. So how have they got to where they are now? And, we are very complex beings. We have everything that makes us up is from, our before birth, our childhood experiences. Sometimes negative childhood experiences can have a huge long-lasting impact on our physical health, our mental health. So having a good understanding about your patients, spending time with them to understand. And in my NHS clinic, I've got the beauty of continuity of care. So I am seeing patients time and again, and you do develop that in-depth relationship with them. So it's about understanding where they're at now, what changes are important to them, and finding their why. So once you can understand their why, you can then help them to implement changes that they want to implement. Because if it's not on their agenda, it's not going to happen. So yes, you can steer people towards, what you think is important, but it's got to be important to my patient. I have to understand where they're at now, what changes they feel are important, and why. And then we can access all the other amazing treatment options we've got, all the hand-holding, the health coaching, the social prescribing, our group consultations. There's so much that we can access, which is very similar to what we do here at HOOKE. And I know we're going to move on to, or I hope we're going to move on to talk about that a little bit as well.
Just go back to, we could probably wrap up the group work, if you like, and move on to the individualized bit. But just talk us through a little bit about the group dynamic.
Oh yeah, I'd love to. Yeah, so
pieces that you do, because I think that's really interesting, really forward thinking, and I know it's not something that's necessarily rolled out across the country, but it's a good way to move forward for the NHS, I think, and for people in general.
Yeah, I think so. The NHS, we're doing our best, but we are stretched. So I think it's about trying to look at interventions that we know work, that are evidence-based, that where there is some science behind it, and that are relatively easy to implement in our NHS practices without a huge deal of effort, because we're also time pressured in the NHS. And one of the interventions I use at my NHS surgery is something called group consultations. So I absolutely love it. So we have a meeting room or the waiting room or wherever we choose to use. So we will have a room with maybe 10, 12, 15 patients who all have the same chronic condition. So let's say type 2 diabetes, and they will be invited to come to their appointment, which is a group consultation. So 12 to 15 people, all with the same chronic condition, all in the same room. They've all signed a confidentiality agreement. so that we can share information. Their results are all up on a big screen, so they can see their own blood test results and they can see other people's. And before I go into the room, they'll have about 45 minutes with one of our health coaches. Sometimes we bring in other professionals like dietitians, social prescribers, but usually it's my health coach, our health coach. And they'll have 45 minutes discussing what that chronic condition is, what it means to them, how it impacts their lives, sharing tips and tricks with each other, and generating some questions for the clinician. And then I will go in for the final 45 minutes. I'll answer their questions. We'll do a bit of a, actually, diabetes is this, or it's, these are what the results show. And then I go around the room doing their individual one-to-one consultations within that group setting. And they've all consented to this. So they will have their one-to-one consultation with me, but within that group setting. So the benefits are that they are learning from what I'm saying to each other, and they're all taking that information home with them. So that there've been really well described outcomes. So practitioner well-being, which is really important. There's a mental health crisis within the NHS as well as in the wider population. So actually thinking about practitioner well-being, that's well described. I love it. I feel energized. I've had a really great discussion with lots of people all at the same time and individually. Patient reported outcomes are excellent. Their social connection, they're sharing their stories, they're learning from each other, they're perhaps making new friends, they have a shared understanding of the condition, but they're still getting their one-to-one consultations, and it's time efficient. So, I don't want to bring it back to resources, but it's time efficient for the NHS. And you can use it for any chronic disease. It works really well for menopause management, for inflammatory conditions like rheumatoid arthritis, for people living with obesity, for type 2 diabetes. So, you can extend it to whatever chronic health condition you want.
Nicola's looking at this like, this sounds amazing.
It brings me back. Like, I worked in the NHS years ago, and we did some great work. Like, we had I worked in a London hospital, and so we had a massive gym area, and we run a really big class timetable schedule. So from acute lower limb to chronic lower limb to upper limb to spinal to Pilates to rheumatoid conditions, hydrotherapy. Like, there was so much focus on exercise and activity, and unfortunately, and obviously you only get kind of bad stories, the longer I've worked privately, we get clients coming from the NHS and they've been given a sheet of paper and kind of sent away, and it's like that active intervention, because that's what creates the behavior change and creates the habit, and also gives someone time to understand why they're doing something. So and it's just massive. So it brings back very good nostalgic memories, actually, of some really great team time, because actually, and this probably rolls on quite nicely in the private setting that I've worked in now for kind of since I was 26, really, so 14 years. It's been like, while we do classes and we have done kind of Pilates and yoga, which have been more well-being focused, the actual physio has been very much one-on-one and individualized. So it kind of comes on probably quite nicely to your work that you're doing with HOOKE now around more individualized care as well, and how that differs, how it's similar, and why have a career of the two different paths, really.
Yeah, no, for sure. So, I mean, we've spoken a lot about my NHS work, and how a lot of wellness and wellbeing resources can be free and should be free. And I know you've had Richie on talking about breath work, and we're going to hear about sleep from Sophie. All these they're free. It doesn't have to cost the earth to start your journey to better health. HOOKE is different in that HOOKE is for people who do have the resources to make an investment in their health. And for me, on a personal level, I really like the diversity that brings to my working week. Here at HOOKE, we take a really in-depth look at all aspects of someone's health. And I'm not saying that this is better than the NHS, I'm saying it's different because we have the resources. So here at HOOKE, we do detailed medical testing, and that will include blood tests, multiple scans, full examination. We do extended fitness testing using longevity markers. We do a full nutritional assessment, a psychological analysis, mental well-being. We look at hormone health, immune health, cancer risk. So really, really in-depth analysis of an individual. And I think here at HOOKE, it's about personalised medicine. So yes, HOOKE is a longevity clinic, whatever that means to people, but we focus on health, on getting somebody in the best physical and mental health that they can be in. And the byproduct of that, the positive side effect, is longevity. Nobody wants to live longer if they are frail and living with dementia and multiple comorbidities. Actually, we want to live the best life in the best health that we can, and that's what we do here at HOOKE. And so that very personalized approach, and we employ a really proactive approach here, which empowers our clients. And those results are very tangible. So we do repeat testing and constant feedback to improve health and well-being. And we surround our clients with a team for that support. Just like in the NHS, you might have a social prescriber or a health coach. Here we have a very experienced multidisciplinary team, a bit like that an elite athlete might have. And we are very science-led. So we don't follow fashion or trends. Yes, we have access to cutting-edge science and the brightest minds in the business, but it's very much lifestyle first. And we've got tailor-made supplements, and we've got evidence-based medications in our toolkit, but we are very focused on getting the fundamentals right. And I think that's where the future lies. I think the future lies in personalized medicine, but there has to be a greater understanding of how vital those lifestyle factors are, and and availability of readily available tools to help people make those changes and sustain them.
Can I play devil's advocate?
Of course.
If the lifestyle approach,
she loves doing this,
the 6 pillars are the basis, and I'm going to make the assumption that regardless of if you're working NHS or privately, that actually doesn't change. When will we, in your opinion, know that the personalized approach actually creates better outcomes? Because what we're saying really is that lifestyle approach and the pillars stay the same, that the depth that you can go into personalized, do we yet know, or is that the future of personalized or longevity really, to understand, okay, actually we've got a general approach, but if we take that personalized approach, we're going to have a 20% better outcome. Because what this comes to me is longevity, and what's happening is kind of cutting edge, and it's pushing the boundaries and the future innovation. But over time, naturally, what happens with innovation is it filters down to become the norm. So do we know yet how much better personalized medicine is to a general lifestyle approach?
So I think, just to pick up on the first part of that, I think, so firstly, what is personalized medicine? What does it mean it means different things to different people. I think what we do here at HOOKE is such in-depth testing and such whole body analysis that we can absolutely tailor our approach to that individual. Some of the things that we use, for example, in the NHS, have to be on a wider group setting because we don't have the time and resources. So I want to state that as a fact, because you can't, it's the elephant in the room. The NHS is very stretched. But I think ultimately, everything we do is a personalised approach. Even the 6 pillars, it's not a blanket approach. It's not one size fits all. It's about using that personalised approach with your patient, with your client, and helping them work on those individual pillars and using a very personalised approach. In terms of as and when you use medication, there isn't a right or wrong answer, because it's joint decision making, shared decision making. It's weighing up the pros and cons within every individual patient or client. It's having those honest, open discussions about where those medications fit in, the additional benefits that they might bring to that patient or client, and helping them make an informed decision. So I think personalized medicine is very much the future, and I think the evidence is coming. So for example, there is evidence that metformin might help with longevity, but actually, is that right for the individual on a one-to-one basis? Maybe, maybe not. Because actually, what do they want to achieve? Do they want to use medication? It's like NAD infusions is a really good example. Everyone's kind of jumping on the bandwagon for that. The evidence is really not quite there. So at HOOKE, we're not, we don't do NAD infusions yet because the evidence isn't quite there, and we're very much evidence-based and science-backed. So I think personalized medicine is the future. I think the evidence is coming for that, and there is in some areas the evidence is already there, but I think it's very nuanced. And I think every patient is very different, and you work with your patient to help them make the decisions that are right for them. Does that answer your question?
Yeah. I think George has an opinion on it too.
Yeah, I think there's an element, isn't there, where the people who go to hyper-personalised levels of care are going there because they don't necessarily want to be part of that bigger group experience to start with. But the more they get into it, then the more they meet other people who have similar interests in taking their care and their health to that hyper-personalised level, the more that they then find value in sharing their experiences with others and the journey that they're going on. But the number of people that are going on that journey is quite small, relatively to the size of the population that we have in the UK, for example, / the world. So retreats that bring together people who want to go down this hyper-personalised journey then gives like-minded individuals the opportunity to share their experience around, right, here are the 6 pillars. This is an area where I was quite poor on, but actually 3 months later, I've worked with a team and I've improved my outcome, and that's improved my outcomes across the board. X, Y, Z, things that I didn't think were naturally going to happen as a result of it. And I think that's where taking hyper-personalised care into a retreat setting is going to be the way forward of how you then transition that into more wider population medicine. Because I think a lot of what, where Claire's there talking about NAD, and I totally agree with what you're saying, but on the N=1 individual basis, some people find a benefit from it. And that's, you could use chondroitin and glucosamine as an example around whether that's going to help your osteoarthritis. And the evidence is equivocal. However, I would say to people, look, if you've got arthritis in your knee and you want to, take a tablet for it, this is an option for you, but these are the side effects which many people get, and that's why they stop taking it. So take it for a short period, see how it goes. Equally, there are injection therapies that can be used that it don't involve, the gastric upset or the indigestion that you might get. And therefore, this might be an option for you as well. So it's that hyper-personalized piece around the NICE guideline is one thing, the evidence base is one thing, but it's individual around what you want to do and where you want to go. And that's where that hyper-personalized care comes in. And that, what you're saying there around understanding the individual that's sitting in front of you and what their needs are, that everybody is a coach. And we've talked about that quite a bit. And Steve Miller, in his episode, really went into great detail around everyone's a coach. How can you help coach that person to be the best person of them, for them, but also for the people around them and everything that goes with it. So that layering in, exactly like you say, multidisciplinary approach that high performance athletes get every day and are used to, individualizing it in centers of excellence like HOOKE will no doubt hook more people into it, because there's a vast amount of information out there. But what people really want is to sit in front of an expert and be told, right, there's the evidence base. This is what I think. These are my health beliefs. Support me to go down this journey so that I can improve where I'm at. And I think, I've said a few different bits there, but that's where HOOKE is fantastic, because it's being science-backed. It's not on the fad. It's not doing what the media is suggesting we should be doing, et cetera, et cetera. And therefore you actually end up turning down just as many modalities as you might accept, because the space doesn't sit there. So that's where I think healthcare is really going in that sense. And HOOKE is very much part of the cutting edge on that. And there then will be, like you say, Nicola, the filtered down piece where the population starts to get that benefit down the line.
Yeah, absolutely. I couldn't agree more. And actually, it's interesting talking about retreats, for example, because, that brings together, it brings that social connection. It helps people to share their knowledge and expertise and learn from other people. And I think we've got to embrace that. Obviously, I am the doctor and I have this wealth of information, but nobody knows you better than you. I am not walking in your shoes. I'm not living your life every day. So actually, you are the master of your own health and well-being. I can help you as much as I can. So let's learn from the individual. Let's share that. So I love that.
And it's a real cultural shift, isn't it? From even probably 30 years ago, maybe, of like the doctor in the white coat, they tell you what to do. You don't question it. I don't know any better than them. So that real kind of hierarchy of medicine. And even I think my parents' kind of generation still hold that belief quite a lot, where we're very much in a different realm of information, really, I suppose, or accessible information. With that comes a lot of confusion, and but embracing the fact that actually you can have a conversation with your doctor about pros, cons, what does that look like, and even bring up things that are not viewed as maybe completely traditional. That's a really great place to be able to kind of be more informed and more health, I think the term is kind of health literate, isn't it? But just health informed. Education is the ability to have more education will never be a negative on our health.
Yeah, absolutely. And I think looking back through, previous guests that you've had on, there's such a lot of wealth and of knowledge out there. Find somebody that you can click with, that you can have those discussions with. It may be that it's not your doctor, it may be that it's somebody else, another healthcare practitioner who you can have those conversations with. But I love a challenge. I love patients bringing information to me going that I've seen this, what do you think? And it may be something I've never heard of. So there's a challenge. Okay, let's have a look at this together. Let me find out a bit more information for you. Let me do my research and we'll meet again and talk. I think it's really important that patients, that the individuals feel that they can challenge doctors and other healthcare professionals, and that they leave feeling empowered to make those individual decisions that will help them on their journey to better health. And that for me is so important. It's about empowering our patients, our clients, so that they can continue this journey towards better health.
I think that wraps up really nicely around, like, if you could give people information today about if you can point them in the direction of where they can find out more information around lifestyle medicine, the services you provide, the services HOOKE provide, where would you point them as an initial starting point?
So I would say if you're interested in lifestyle medicine, if you're a healthcare practitioner and you want to learn more, then the British Society of Lifestyle Medicine, our website, has a wealth of information there. And we've always got courses and meetings and webinars and things like that. HOOKE has our own website, hooke.london, and we are really welcome to talk to people if they are just interested in learning more. There's no commitment at that initial stage. And then I think for individuals, I always say to my patients, and I will recommend them to a few podcasts that they can listen to. This is a really good example of a brilliant podcast that can help empower patients. But I would say just find something that makes you feel good about yourself. Get your trainers on, go for a walk out in nature, take a dip in a freezing cold river, whatever it is that floats your boat. Embrace it and get other people to do it with you, and get someone to hold you accountable, because that's when you'll start to make those sustainable changes. When you've got someone going, did you do that today? Have you done that? There's a wealth of information out there.
Well, that's wonderful, Claire. I think that's a nice way to finish not just this episode, but this series. Nicola and I have had a lot of laughs doing it. Nicola's asked more questions than me, which is always good. She's a curious cat. Thank you to Nicola for all her effort on this series. Thank you to all our guests. Claire, you've been brilliant. I think there's a lot of reoccurring themes, which is essentially just take a step forward. There are plenty of experts out there. Don't be fooled by what someone just says on social media. You can just back it up, because sometimes people just shout loudly, but they're not necessarily the most qualified person out there. Centres of excellence are always a good place to start, even if you just want to engage with their website, just to understand the landscape of what medicine or breathwork or psychology or nutrition or sleep or some of these newer paradigms that are out there that can help people are about. And it's been great. I'm actually going to leave Nicola to say the last words, but thank you to everybody who's been involved, and over to you, Nicola.
Oh, there's the pressure, George. It has been a really interesting conversation, and I love that this is the last episode, because it does wrap up quite a lot of those conversations into that holistic conversation. And if we really try to think about what Citius is trying to achieve, it is that holistic approach to a person. And I often, with my strategic hat on and business and commercial hat, I'm thinking, what is that value proposition? What is it that allows people to thrive? And sometimes it is just space, time, and like that helping hand. So I think that resonates with the conversation that we've just had as well, around helping people and empowering them and bringing together that holistic approach. So yeah, thank you, Claire, for being part of this last conversation. Thank you, George, for all the fun. And yeah, I look forward to these last episodes going out.
Absolute pleasure. Thanks, guys.
That's the end of this week's episode. Thanks again to our kind sponsors, IBSA. Osteoarthritis is the leading cause of pain and disability in the UK. As our bodies age, there is a loss of naturally occurring hyaluronic acid within our joints, which can lead to reduced shock absorption and lubrication. This can contribute to the development of osteoarthritis, resulting in joint pain, stiffness, and difficulty carrying out daily activities, such as going to work and exercising. Synovial HL is a joint injection with the highest concentration of hyaluronic acid available in the UK, effectively restoring hyaluronic acid in the joint. It is scientifically proven to reduce pain and increase joint function, preserving your joint into the future. Synovial HL is injected in a simple procedure which offers an alternative to medication and surgery. If you'd like to find out more, please visit synovial.co.uk for full product information and a list of clinics offering Synovial HL injections. Synovial. Move freely, live fully. Disclaimer. The procedure must be carried out by an appropriately trained healthcare professional.